as more and more patients are not able to get into the hospitals because of full capacity, is there a way for COVID-19 infection to be managed at home? So what if COVID-19 infection hits home? Can we manage COVID-19 infection at home? What are some of the tips that we can do to help mitigate measures so we can prevent that this condition will get into a more severe, unserious condition? For me, the most important aspect in the safety protocol and the ability to stop transmission is using the right face mask. Let me review with you, because a lot of my patients in the clinic are either using the surgical mask or the cloth mask. So let's look at this cloth mask, because this is a non-medical mask which is made of fabric or other materials. Now, it is very good, better than none, because it protects others from the wearer's respiratory emissions. But at the same time, it can offer the wearer some protection. But remember, the efficacy of this homemade cloth mask is only between 26 to 80%, because it depends on a lot of factors. Depends on the fabric that is used and how many layers is your cloth mask made of. So the World Health Organization, if you're going to use a cloth mask, recommends a 3-layer structure. Now, surgical mask is also known as the medical mask. Unfortunately, some of us don't like to use a surgical mask because it does not look good. So one can wear a surgical mask, then on top is a cloth mask, which will be okay. So you are double masking. In fact, that's a recommendation to help reduce chances of getting the COVID-19 variant. Now, the surgical mask protects from the wearer's respiratory emissions and definitely is a better mask compared to the cloth mask. It generally offers more protection but less than the tightly fitted respirator. Now, surgical mask is recommended for healthcare workers or people who have symptoms. So if one of you will possibly get the symptoms of fever and cough and you're not sure whether you have COVID-19 or not, then the best way to protect the environment, to protect other people, is to use a surgical mask. Very important, this is also the recommended mask for anyone age 60 and above, because remember, patients who are elderly are one of the most vulnerable to get COVID-19. And please offer them the cheapest but the best protection using the surgical mask. On the other hand, the respirator or the N95 masks are reserved for healthcare workers because the efficacy here is 95% effective in blocking small and large particles. And this is the mask that is recommended for those taking care of COVID-19 patients in high-risk aerosol generating procedures. So again, please make sure that even if you've been vaccinated and most of your friends or outside of your household are not vaccinated, continue to protect yourself from getting COVID-19 by using the right fitted mask. So aside from the surgical mask, are there other measures that you can do to help reduce your chances of getting COVID-19 infection in spite of the fact that you already been vaccinated? Again, remember, you may be vaccinated, but you don't know if your friends are vaccinated, and therefore continue to protect yourself. So here are some ways. There are actually 3 factors to help you make safer choices. So here are some steps. First, very critical is the location. If you have to go somewhere, of course, open air spaces like a beach is better than enclosed spaces like a shopping mall. So this is a given because in a shopping mall, it's an enclosed space where airborne particles of COVID-19 can go around and you may be able to get it if at the time you're eating in an enclosed space in a shopping mall area. Second, the proximity. The farther away you are from others is safer than if you are close together. So this is where social distancing mechanism is very critical. And third, the time. The longer you are with somebody you don't know, the longer you are talking and laughing with a group of people not in the same household, the longer you are exposed to the possibility of COVID-19, then the higher is your risk. So shorter time periods with others are safer. One of the major issues that most of us, that I always see in our practice right now, is the fact that most of our patients who are admitted for COVID-19 infection has a history of eating out twice in the past 2 weeks prior to getting admitted for COVID-19. And why is this so? Because it has been shown the transmission of COVID is highest in indoor setting, in closed space, where it's air conditioned. When you go to a restaurant, the tendency is, of course, to remove your mask and to eat. And sometimes you eat approximately more than 30 minutes. And you're with other people which you don't know whether they have asymptomatic COVID infection or not. So if you are at least 6 feet apart and it's an open space, then you're at low risk. If you want to enjoy restaurant food, what I usually do is get delivery. COVID-19 or SARS-CoV-2 is airborne. Ventilation is key. One of the reasons why you don't get COVID-19 infection in most of our clinics is because we are following safety protocols. If you get inside my clinic, I know it's going to be hot because there's no air conditioning. My windows are open. We have all air filters, and you cannot enter my clinic without a mask. So safety protocol will continue to be implemented, even if both of us, if I'm fully vaccinated, because I really don't know which patients of mine have been vaccinated or not. Of course, recent data have shown that since it's pandemic, you're staying home, make sure you keep fit, eat healthy foods, and of course, exercise. This is a very important data showing that physical inactivity is associated with higher risk of severe COVID-19 infection. And this is based on a study of 48,000 adult subjects. Thereby, it is recommended that you exercise daily, because if you do get COVID-19 infection, but you exercise regularly, you are less likely to be hospitalized and to die from COVID-19 than those who are sedentary based in this new study. So exercise do help. What if you get COVID-19 infection in spite of being vaccinated? And of course, right now, most of us are still with the first dose of Sinovac or the first dose of AstraZeneca. Or what if one of the members of the family is positive for COVID-19 based on a swab test? What do we do when the hospitals are full, when we don't have a way to get beds right away? Here are some tips. If anybody is positive for COVID-19, but one, asymptomatic without risk factors for severe disease, if the patient is clinically well with no shortness of breath, breathing comfortably, and if you ask him or her to speak in long sentences, they can do it easily. You can count the respiratory breath. And if you do a pulse oximeter and it's 94% at room air, then that patient who has just been diagnosed with COVID-19 based on a positive swab test can stay at home. However, there are some rules that we need to practice in terms of home care. Here are some pragmatic tips for managing COVID-19 at home when hospital or medical care is not accessible. First, if you have early COVID-19 and you always have to monitor with pulse oximeter and it's been stable above 94, 95%, mask all the time inside the house. You have to be isolated in your own bedroom. Open the windows, proper ventilation. Make sure, because of the heat index nowadays, please stay hydrated. If you have some low-grade fever, it is also okay to take supportive measures like analgesia. We don't recommend some of the commonly used vitamins because really don't have data to support them as helpful. I would say their placebo effect, like vitamin C's, or even the Chinese medication Yanhua, because most of these asymptomatic patients anyway recover on their own. Whether you take the Lianhua or not, the Lianhua has a placebo effect. It's been approved only for relief of symptoms, but not really for COVID-19. Once your oxygenation starts to drop, but it's still above 92%, then paracetamol should be continued for fevers and aches. You continue to hydrate yourself with water and fluids, preferably some oral rehydration solution. And then it is our recommendation that you sleep in a prone position so that you can improve lung oxygenation. One very important study recently is the use of inhaled budesonide, which is a steroid that we give for allergic cough or asthma. The University of Oxford researchers recently found that patients who took the drug budesonide when their first COVID-19 started were less likely to need urgent medical care or hospitalization. It also reduced the chance of persistent symptoms and fever. When do you need to go to the hospital? When your oxygen saturation starts to go below 92%. Then you seek hospital care if possible. Here you will be given dexamethasone, but while you are still awaiting bed, home oxygenation if available, use the lowest amount to keep your saturations more than 92%, continue to hydrate, give paracetamol for fevers, and continue to monitor oxygenation. Some patients will also be given antibiotics if needed because of secondary bacterial infections. If you will note in the past videos that I did, I've been urging people, appealing most of you to please get the vaccine because it's the only way we can get out of this pandemic. We have some roadblocks along the way because of the reported blood clots. But you have to remember that getting COVID-19 is worse than getting the side effects of blood clots from vaccination. When someone gets the COVID-19, your body produces inflammatory proteins that will activate the immune response against pathogens. There will be excessive numbers of killer T cells in the recovery period, indicating a persistent and overactive immune response. And this heightened immune response activates the inflammatory proteins that can attack the blood vessels, causing them to leak. This leakage then leads to blood clotting. So blood clots then form in the major arteries that cause a heart attack, a stroke, or organ failure. And this is what we have to watch out for if you get COVID-19 infection or even if you have recovered from it. So higher blood clot risk due to COVID, even in people who have recovered, it's regardless of the severity of their disease. These patients with COVID-19 will continue to be at risk of developing blood clots due to an overactive immune system, meaning it is safer to prevent COVID-19 infection by getting a vaccine than getting this risk of blood clots even after you have recovered from COVID-19. If you look at cerebral venous thrombosis risk, in the general population, it's 3 to 15 per million. However, if you got COVID-19, it's 20 cases per 100,000 COVID-19 cases. So there's a 14 to 66% higher risk of thrombosis if you get COVID-19, similar to pregnancy or oral contraceptive pill. But look at your risk to get blood clot with a vaccination. One of those that has been reported to also cause blood clot is the Johnson & Johnson. Here it's 6 per 6.8 million vaccines given. It's 0.00009%. What are your chances of being hit by lightning? 1 in 500,000 or 0.0002%, meaning you have a higher chance of being hit by a lightning than getting the blood clot from COVID-19 vaccine. So my appeal again, I have shown you that yes, even with the first vaccine, you can still get COVID-19 infection. How much more if you're not protected? Wait until the second dose of your COVID-19 vaccine for the 2-dose regimen before you can get fully protected. But we won't all be fully protected unless most of us will be vaccinated. And that's the bottom line. So I hope this simple video on how you can manage COVID-19 at home will be helpful. Staying home during this pandemic, continue to be healthy, continue to exercise, continue to practice the safety protocol, and hope to see you again soon. This is Dr. Jerry Tan. Thank you very much for listening.